Hello, my name is Olga, and today I'm going to tell you about career within healthcare. So first of all, career itself, it refers to something, a position or an occupation that one has taken over a long period of time within his life. So in healthcare, there are different paths, because I don't think that the health profession is only regarding the doctors and the nurses, or the people that really know how that have that knowledge about treating the patients. Healthcare has a wide range of careers. So some of those careers are like working with the patients. They are like the medical assistants. So these people, they deal with working, recording the schedule of the doctors so that they can know how to attend to different patients. So this is another career that is found within healthcare, but then that does not directly link the person to the patients. So another career that is found in the healthcare field is like the healthcare administrators. These, they oversee the overflow of the healthcare offices or the project. These, they might be the financial management, the staff recording, the staff coordinating, planning, and etc. So they overlook how the healthcare institutions are progressing, or how they are functioning in their daily life. So there are also the allied healthcare professionals. These are the field that provide services that are delivered, services including identification, evaluation, prevention of diseases and disorders, dietary and nutrition services, rehabilitation, and also health system management. These people are supposed to be having a bachelor and or graduate degree. So you can see that within healthcare there is a wide range of healthcare health careers. So one can always be in healthcare but not necessarily dealing with the patient. He or she can always deal with the person, deal with healthcare, but not administering the medication to the patients, but instead assisting the doctors or the nurses, or even making sure that to overlead them within their workplaces. So to be more clear about my research, I want to focus on the nurses and also the different perspectives found in healthcare. So let us include these slides. So first of all, as an overview, the clinical approach to career healthcare refers to the different jobs that have to do with treating patients or providing direct patient care of any type. So this refers to the clinical approach. It's like when you're clinical, it means that the person is already working in the field, as in he directly meets with the patient. But then for the non-clinical approach, as it is listed here on the slide, non-clinical approach is a career that refers to the different jobs that are done in the health field, but then don't involve direct contact of the worker with the patients. So you can see that there is always the clinical career and the non-clinical career within the healthcare field. So going next, there are the several skills requirements that one needs to have within to be able to become a health professional. So first of all, according to Malugani, so the skills that are required for a person that was most of the times to non-clinical careers, they are referred to as transferable skills. So first of all, there is compassion and empathy. So this is something that one can always acquire. So for example, you can be a person that has already attended many volunteering events. So for example, in our secondary schools, there was this Croix Rouge that was in the action of helping the different people that were injured. So this is something that helped the different students that were together in our classes to learn how to be patient with the person that is aching. they knew how to respond to that person. They knew that it emphasized their skills about learning. So secondly, there is also strong communication skills. So for example, there is active listening skills, writing skills that one can be have acquired in classes. So for this, it's like when you're dealing with you already have these skills. So for example, in my classes, I already have the communication classes. I mostly do the presentations to emphasize my public speaking in front of people. So this is something that will be very helpful, and I also tend to listen to many different audios, but then when I'm doing that in classes, I emphasize the fact of learning those listening skills, communication skills, and even writing skills when I'm making some research or writing some reports about my research. So this is something very useful, for it helps me to go overboard, as in to grow strong communication skills that can be very helpful when I'm in the healthcare field, but then not directly doing the clinical career. So another thing is like the customer care know-how. So for example, the customer care, it should always, the services, like for example, I gave the example of a receptionist. So most of the times you see that the receptionist, they are always smiling, as in they know how to treat their patients. So this is something very useful, because when you know that the patient, you know how to handle the patient, you're not enraged about the things that he or she might be doing that are wrong. So I think that having the customer care service know-how is like something very useful when you're going to present yourself to a patient, because you'll be very patient and agreeing with her most of the times. So another thing is like the last skill requirements that I enumerated was the grace under pressure. So for example, this skill, like it's the more like of the decision making. I mentioned, for example, the skills of the flight dispatchers and the pilots about stress management. For I know that these people most of the times, for I read in the New Times that they know they are faced by a lot of pressure when they are working. So this is something that they are trained to do. They are trained to manage their stress. So this is something that can be very helpful in their field, because they can always be able to take decisions that are rational and as quick as possible without wasting any time. So I think that this is something very helpful in the healthcare field, because most of the times they face also some emergencies that needs to take decisions. So I made a case study of the different levels of nursing. So according to Anna, the levels of nursing are the licensed nurse practitioners, registered nurses, and nurse practitioners. So the licensed practitioner nurses, they are the nurses that complement the healthcare team by providing the basic and routine care consistent with their education under the direction of registered nurses, advanced practice registered nurses, or medical doctors in a variety of settings. So for these nurses, they are not yet ready, as in they require a given surveillance to be able to practice their knowledge, because they are not yet ready. So they are already nurses, but then they are not yet able to perform an operation on their own. They require some surveillance so that they can be guided to make it in the right way. So the other category I talked about are the registered nurses. So the registered nurses, these are the nurses that are licensed and that are able to provide the healthcare in different locations. They are not under surveillance and can supervise others most of the times. Like I mentioned earlier, they supervise licensed practical nurses. They can perform different exams and also administer medication to patients. So these nurses, these forms of nurses, they know what to do, as in they have the knowledge that is required to be able to administer something. They are not surveyed, because they know that they have that license of nursing. They know how to take care of patients. So another section of the nurses, this is more like the advanced nurse practitioners that I mentioned earlier. These are the nurse practitioners. They are registered nurses that have at least the master's education and clinical practice requirements beyond basic nursing education. They can work in different areas like home, hospitals, private offices, and they can provide a wide range of primary care services, prescribe medication, treat common minor illnesses, and diagnose them. So this is something, they are above the registered nurses. For the registered nurses, they are not allowed to treat any patient. But then for these nurse practitioners, they already have a master's degree. They have further knowledge about how to deal with the patients. So this gives them the right to administer the prescribe some medications and diagnose, treat common minor illnesses and injuries. So as conclusion, the healthcare career requires different skills. This means that many people can always find themselves in the healthcare field, but then doing by using their different set of skills. So in addition to that, there are different categories. As I've shown earlier, the nurses are divided into the nurse practitioners, the registered nurses, and also the licensed nurse practitioners. So you can see that they try to divide them according to their level of skills. So here is the bunch of references of the sources I got my information. So thank you for your kind attention throughout this presentation. Thank you.